Welcome, everyone. I'm Alicia Cohen. I'm the director of the Hubbard School of Journalism and Mass Communication, and I'm also a professor in my work life. I'm a professor in the area of health communication. Thank you for attending our program in the area of counteracting the anti-science movement. At the University of Minnesota, we are driven to discover, and for decades we've trained researchers, students, and scientists with a fundamental belief that scientific innovation is a leading driver of Minnesota's growth, economy, sparking the revolutions of scientific computing, communication, biotech, medical device manufacturing here, advancing public health with early detection, primary prevention methods of disease such as cancer, and research in genetics poised to transform the practice of personalization and many other fields. Yet, a recently robust social movement has emerged against what one of our panelists, Sean Otto, describes as the scientific foundation. Positions of anti-science against evolution, human and climate change, against vaccines, and others. In my field of study, health journalism, recent big data studies evaluating the quality and quantity of scientific information suggest that journalists largely do, by and large, align with scientific backing in their articles, but at the same time, often traditional professional news values of reporting balanced and diverse sources lead to an underreporting of scientific consensus, where one clearly does exist. And in the era of social media, anti-science ideas also encounter support from what I would call anti-science antecedents: unscientific opinions, misinformation, disinformation, malinformation. Each of these are more easily magnified and shared with our virality in our mediated information economy. In short, it is difficult, if not impossible, to catch and to kill an anti-science position, or really any bad idea. To address this concern, we have three experts who each will speak on this issue in the order in which they're presenting. First, Sean Otto is an award-winning science writer. He's a middle, screenwriter, and novelist. He is author of The War on Science, which has been called a game changer and probably the most important book that you'll read this year. He speaks worldwide on this critical issue of science and truth in free societies. As a screenwriter, he wrote and co-produced the Academy Award-winning nominated movie, House of Sand and Fog, and wrote the critically acclaimed LA Times Book Prize finalist, Sins of Our Fathers, a literary crime novel. Otto was awarded the IEE USA National Distinguished Public Service Award for his work elevating science and American public dialogue. He is co-founder and producer of the U.S. Presidential Science Debates at sciencedebate.org, and is the only person to get Donald Trump to answer science questions during his presidency. Congratulations. Second, we have Dr. Sarah Wright. She is an associate professor of health policy management in the School of Public Health. She teaches courses in health policy analysis and on the ethics of public health practice and policy. Her research agenda is about how evidence gets translated into media and the policy-making process as well. She is also an associate director of the Robert Wood Johnson Funded Interdisciplinary Research Leaders Program, a national program supporting researchers and community leaders engaged in health equity research. Finally, we have Dr. Brian Southwell, who is the senior director of the Science in the Public Sphere program in the Center for Communication Science at RTI International. In addition, Dr. Southwell is an adjunct professor with Duke University Social Science Research Institute and a scholar in residence with the Duke University School of Medicine. He's a graduate faculty member at the University of North Carolina at Chapel Hill as well. He also hosts a public radio show, The Measure of Everyday Life, for WNCU 90.7 FM. We look forward to hearing each of your presentations. Each of the panelists will present for about 10 to 12 minutes. Then we'll have a discussion together for about 20 to 30 minutes, and we should have about 15 minutes for question and answers from the audience. Without further ado, I'm going to let our panelists who are not presenting sit in front so we can see, and I'll ask Sean to come to.
Okay, good afternoon. So, Google the phrase of war on science, and they're going to bring up hundreds of articles now about the way that the Trump administration has undermined evidence as a basis for policy that maybe the president disagrees with in one way or another. But the problem isn't just in the United States, it's really worldwide. I was talking with Beth earlier about how, for instance, in Colombia, the prior mayor of Bogota had bought 50 electric buses. But the new mayor, or maybe it was 500, I think she said 500, but the new mayor bought 1,000 diesel buses to trump the prior mayor, and argued that there's no evidence that diesel is bad for the environment. So that type of thing is happening everywhere that I talk around the world. Everyone is increasingly concerned about this. Authoritarians who deny science are feeling emboldened by the example that the Trump administration is setting. So why is this all critical? Really because of the fundamental idea that democracy is based on evidence. Wherever the people are well informed, Thomas Jefferson wrote, they can be trusted with their own government. And that's the key, is what does it mean to be well informed? Especially in a day and age when science is becoming increasingly complex. So complex, in fact, that we can't necessarily expect politicians to understand it. What do you think might be happening here?
You did not answer the question.
I think it's
No, you did not. You did not answer the question of why the president asked the White House press secretary to come out in front of the podium for the first time and utter a falsehood. Why did he do that? It undermines the credibility of the entire White House press office on day one.
Don't be so overly dramatic about it, Chuck. You're saying it's a falsehood, and they're giving Sean Spicer, our press secretary, gave alternative facts to that. But the point really is
Alternative facts, 4 of the 5 facts he uttered. The one thing he outlined is Zeke Miller, 4 of the 5 facts he uttered were just not true.
So I don't know what's happening with the sync there, but this was day one of the Trump administration. I don't know if you remember. He certainly set the tone. He was arguing that 1 million people, the hugest crowd ever, had attended his inauguration when the photo showed far left. But it's not just the Trump administration. This is happening at state and local governments as well. For instance, this was just a couple of weeks ago in Ohio.
Weighing in on how public schools can teach things like evolution. The House today passed the Student Religious Liberties Act. Long story short, students cannot be penalized if their work is scientifically wrong, just as long as the reasoning is because of their religious beliefs. Instead, students are graded on substance and relevance. Every Republican in the House supported the bill. It now moves to the Republican-controlled Senate.
So what I think is really instructive about this particular clip is that every Republican supported the bill. Now, this isn't a knock on Republicans. What it is it says to me that tribalism, for some reason, is now trumping evidence as a guide for decision-making. So, in that kind of view, how do you suppose Thomas Jefferson would think about this today? And I would suggest it be something like this. The problem is, we're seeing increasing complexity. We're seeing problems with objectivity and how we regard objectivity. And we're seeing an increasing drive towards grievance identity politics, which is what I call it, that comes out particularly out of social media, but also about the subjectivizing of all of our public policy discussions. So I'll talk about those 3 issues, and then I'll give you a little bit of story, because what I'm trying to do is just set a context. I think that Brian and Sarah have some great research here on stuff to present, and all of this is based on research, but I'm going to kind of try to do some context setting for the discussion. So the complexity thing has really evolved since about the year 2000, I would say, where we're seeing a consilience between fields of science, and science is really producing tremendous new insights, but it's also becoming so complex that even scientists really must trust other experts from other fields. No one can really know everything about everything that's being discussed today. And at the moment that that happens, we run into problems with democracy. Arthur C. Clarke once famously said that sufficiently advanced technology is indistinguishable from magic. And in fact, that's kind of the way that it's happening right now. If you can't take apart this iPhone like you could as a kid maybe a generation ago taking apart a radio or a television to figure out how it worked and put it back together, with microprocessors it's become somewhat inaccessible. So it is with much of our knowledge these days. Unless you're a specialist in the field equipped with advanced equipment, you really can't do that. What this does is it takes the science and makes it more like Harry Potter's broom. They're both made by people cloistered away, wearing long robes and other strange incantations. And at that moment that it becomes inaccessible, science becomes less a matter of know-how and more a matter of belief. And the second it becomes a matter of belief, we become vulnerable to manipulation. And ergo, so does democracy, which relies on the will of the people. So objectivity, in this increasing world of complexity, we're relying more and more on journalists to tell us what's really going on. as they've always served in Jefferson's view of democracy. The fourth estate was there. This is why he supported public education and a free press, was to keep the voter well informed. So there's more and more burden placed on journalists to do this in a world where science is making incredible advances, but they are more and more difficult to understand and more arguable. So this idea that came out of the movement of postmodernism about 40 years ago in J schools, that there is no such thing as objectivity, is by some journalists and some editors and publishers really becoming a mantra that is harming that effort. Here's an example from the Voice of San Diego New Reporter Guidelines, and you can see it right there. There's no such thing as objectivity. They go on to say there is such a thing as fairness, and often reporter guidelines say there's such a thing as fairness and balance. But the problem is that this is being taken literally by many, many reporters, and they move on to say, well, if there's no such thing as objectivity, what I need to do is be fair and balanced, so I need to seek out people on both sides, because I might not be objective. I have subjectivity that might be influencing the way I look at things, so I'm not going to judge whether somebody is correct or not just because I think that they are. I'll seek people on both sides and I'll do a fair representation. So we see this happening throughout journalism. There's Linda Ellerby saying there's no such thing as objectivity. On the other hand, through propaganda outlets like the Russian-controlled RT network, short for Russia Times, where the editor there says all journalism is opinion. This is only a matter of degree. And then, of course, straddling these two between propaganda and journalism is Fox News, where it's a little bit of both mixed together, and that's arguably more dangerous because there's a generation of people that have grown up believing what they hear on television. Older folks who don't necessarily have mastery of modern technology. And so they're very vulnerable to that kind of manipulation of information. Then there's the grievance identity politics, the emergence of this. In addition to kind of a mix of opinion and journalism that is happening, is the rise of worldwide social media platforms. And Mark Zuckerberg has argued successfully in Congress many times that Facebook is not a publication. They're not a publisher. They're just a platform. But in fact, their algorithms exercise editorial judgment every day on every post, picking posts to present to you that they anticipate from your past clicks that you're going to respond to. So what that does is it has the effect of amplifying confirmation bias among everyone that's on social media and breaking people into various camps. This confirmation bias confirmation or reinforcement is really behind a lot of issues of growing anti-science around the world. For instance, just last week, World Health Organization Ebola workers, 4 of them were murdered in Congo, in the area where we're seeing the second largest Ebola epidemic ever, and where 1 out of 4 people now believe that Ebola doesn't even exist, that the whole thing is a hoax, use that familiar term now, by government bureaucrats who are just trying to get more Western aid money. And so militias are seeing these kind of rumors, particularly on social media, and they've attacked health clinics now well over 100 times. So, to show how this, to just kind of finish up by setting the context, to show how this is playing out, I'll take you through a little story about the town of Eden. Eden is a mythical town where people don't really have an understanding or much knowledge of math, but fortunately they have Susie scientists who tells the policymakers there in the city council that 2 + 2 = 4. And this is helpful in making public policy because you got to get your numbers right, otherwise you can be steered off in the wrong direction. But then there's Paul who says, wait a minute, no, I've always experienced 2 + 2 = 6. And that's my perspective. And the public starts responding to this thinking, well, I wonder who's right. So Susie has this bright idea and says, well, I can demonstrate with these 4 apples that clearly Paul is objectively wrong. Enter Media Marcel, the journalist in this case, who's been taught that there's no such thing as objectivity, the best we can do is be fair and balanced. And he thinks that, well, how do I approach this story? I don't want to put my foot on the scale by portraying one side as having the truth and the other side is not. So I'm going to go out and I'm going to interview people on both sides and I'm going to present the story as fairly and balanced way as I can. And so that's in fact what he does, not really realizing that by presenting it in this way, he is in fact putting his toe on the scale because he's elevating the role of opinion to the level of evidence-based or informed opinion, and they're not the same thing at all. What happens as a result of that? Well, the town folk break out in controversy because they're seeing this portrayed as an even-handed debate, or as a somewhat even-handed debate, and contrary to the idea of journalists that we can just wash our hands of it and the smart public will decide, they don't decide, they break into arguments over it, and of course then we see media getting involved, bouncing off of this and amplifying the debate, and we see social media getting involved as people on either side of it start posting media articles that support their position and snarking on the others, amplifying the rancor of the discussion. Then there's the CEO of Eden Code who sees all of this and realizes, doing a little math, that 2 + 2 being 6 means 1.5 times the profit of 2 + 2 being 4, so it's in his best interest to back Paul's position, so in fact that's what he does, and we see a lot of avatars popping up on social media, thousands of them maybe, representing Paul's position and slamming people who don't hold that. Meanwhile, Susie argues, well, if that's the case, we got all kinds of extra 2s floating around and they're going to pollute our lake. And what are we going to do with them? And this is just not making any sense. And the CEO of Eden Co responds by saying, well, we really need the jobs. And even though Eden Co has pretty good, or even though Eden has pretty good employment, people start thinking, well, could I lose my job? And this becomes more of a battle over the economy and the environment then. You can see how these things evolve naturally through this progression, and battling over the environment and the economy, over what a fact is and isn't. Everybody here believes in science and has high regard for it. The polls show that across the board, across parties, people hold scientists in high regard. So, nevertheless, they break into opposing camps, arguing with each other over this issue, similar to the arguments over climate change, over vaccination, over whether cell phones cause brain cancer, and on and on and on. Then, of course, foreign powers get involved. They see this debate in Eden, and they decide, well, we're going to weigh in with disinformation to amplify the discord, because any time that we can cast suspicion on democratic institutions, we weaken democracies, and that provides more room for authoritarians like me, that's Vladimir Putin, to act. And in fact, the Putin government has spent a lot of money amplifying anti-science positions and planting others, particularly in conservative communities, like the heavy backing of the anti-vaccine movement they've been doing in Texas recently. So the city council weighs in on this and decides, well, we've got a big controversy, we've got to make a decision here. Well, let's compromise. How about we pass a new ordinance that 2 + 2 = 5. So you can see how this kind of discussion then sees public policy away from reality, away from that evidence-based debate and decision-making, and more towards extreme views and absurdity. And what happens out of this? Well, Eden Co gains from their manipulation. The environment is degraded, though. But the really big thing that comes out of this is that citizens on both sides feel more embittered from the discussion and more loyal to their tribe. And at that point, tribalism becomes the main critical factor in who we elect and who we don't. And it's very true that any one of the authoritarians who next run for city council in Eden could actually shoot someone on Fifth Avenue and not pay any penalty, because that's not the basis for the election. We want somebody who's going to be there and represent our side against those bad guys that are going to try to tear us down. And so this is where we get through this kind of emerging combination of complexity and thus the mysticism and obscurity of advancing science, issues about how we think about objectivity and define objectivity, and the role of journalism in providing voters with the truth, and then the emergence of confirmation bias-driven social media that creates this grievance identity basis for politics. And with that, I think I'm going to wrap it up and let Sarah step forward.
Disappoint you all and let you know that I don't have any cartoon characters in this presentation. I really apologize for that. But what I do have is some of the research evidence from my own work over the last 6-7 years that speaks to some of the issues Sean laid out so nicely around what the public thinks about science, how evidence is or is not used in policy, and where we can go from here. But because I will be talking to you about the results of some of my empirical research, I wanted to start by just grounding you in what it is that I do. So how do I collect the evidence to support the propositions I'll be presenting to you today? So I generally use 3 different research approaches, 3 different types of methodologies in the work that I do. So I do news media content analysis. That means I watch a lot of television professionally, as do some of my research assistants who are in the room. So watching media messaging on TV and print to better understand what are the possible messages that the public is even exposed to, so we can better understand what might be those effects of messages. To understand effects of messages on the public, I do surveys of public opinion in order to assess whether, in fact, people are exposed to the types of media messages that might potentially be corrosive or not on their beliefs and attitudes. And then I do qualitative interviews, so actually talking with journalists, public relations representatives, policymakers, and scientists about their perspectives on the knowledge generation process and on how the public and policymakers become informed. So I want to orient this discussion around 3 key research findings that I've identified over the last, again, since about 2012 when I started a series of studies I'll be talking about. And this is what I found. So one, I think the sort of bright spot, or the glass half full, is that most policymakers do want to make their decisions on evidence, but there are significant challenges in doing so. So challenges in how evidence gets presented and is available to them from science, as well as challenges in, of course, the multiple other influences on the policymaking process that are important and significant and ought to have a role in policymaking. Second, the public's views on the politicization of science are nuanced, so it's hard to talk about one single perspective the public has towards science in general, because actually their views on particular scientific issues or public health issues differ substantially. And so when we think about the sort of public views on science, we need to think about, well, science about what? I think it's really important. But sort of the bad news is that I think there are consequences for the public's support for the policies that we know to be true in public health to potentially advance public health, improve health and well-being, if the public's trust in science gets eroded or potentially becomes further eroded from where it is today. And I want to point out, this is not all gloom and doom. I think in each of these key findings, there's areas of bright spots and opportunities to look forward to in the future. Okay, so first, how do I gather these ideas that, maybe there is scientific evidence being used in policymaking? So colleagues and I conducted an analysis of legislative materials related to 13 obesity prevention bills that had been introduced here in Minnesota between 2007 and 2011. And we quantitatively analyzed all those materials. So this included legislative testimony, it included meeting minutes, including reports that were passed around to come to a number, essentially, how often was scientific evidence used in these legislative discussions around obesity prevention. We found that, this is again, glass half empty, glass half full, 41% of these documents cited research evidence. Is there room for improvement? Obviously. But is there a substantial relationship between legislative conversation about obesity and evidence about the public health concerns around obesity? Yes, there was. We went on to do qualitative interviews with advocates, with legislative staff here in Minnesota, legislators themselves, as well as people at health agencies, and found that the majority of people we talked to, certainly there could be a response bias, right? Talking to university researchers and research assistants, but people did say, in what we sort of discerned to be genuine, that they wish they could incorporate research evidence into policymaking. So we could say maybe Minnesota's different, and let's be honest, Minnesota probably is different. But we heard 3 particular ways that these policy actors wanted to incorporate research evidence into their professional work in supporting policy decisions. And so that means potentially using research to support decisions that politicians already wanted to make. And so I think that's important to think about when we think about sort of the normative importance of evidence-based policy. Sometimes evidence is used in support of a policy decision that might have been come to even without the evidence, but the evidence can be used as a persuasive tactic, as a sort of rhetorical device to support a policy perspective. It can be used in educating the public. So why is this policy important for the state of Minnesota? That's where the evidence might come in. So it might not be in the sort of tactical making a policy decision, but in sort of building the trappings around the policy. And then respondents in the study talked about use of evidence in countering other types of arguments against a policy, particularly ideological arguments. So in a sort of subsequent study, we took this national, and so we conducted interviews with state policymakers around the country to get a sense of the sort of beliefs about research-based policymaking in other state legislative contexts. And the perspectives were not quite as rosy as they were in Minnesota, but still the majority of the folks we talked to talked about, yes, evidence is at least somewhat important to the state policy work that I do. But in this study, the policymakers were not at all shy, and I know that these interviews were before the Trump era. So we conducted these interviews with state legislators in the summer of 2013, and at that point, they were not shy in expressing challenges and concerns they had with science and evidence. They noted a lack of time. There's a deluge of research. It's not a scarcity of research. It's actually too much. And then not having the time, the expertise, the staff to sort through it and what it all means, how to understand it, how to engage with it. Some express cynicism about biased science. So when policymakers are talking about, when we ask them sort of how do you use science in your policy work, they didn't say, what science, there's no science. They said we see it all the time and it always has a perspective. So the policymakers themselves think of science as what lobbyists and interest groups bring to them in making their persuasive argument. And so we in the academic community kind of need to better understand what sort of the policy community thinks of when they think of evidence-supported policy arguments. And then we heard some outright mistrust of research and of research institutions. So as an example of the question about science bias or issue of science bias, we heard most of the information that comes to legislators is not pure science data. So this idea that there might be some pure science data and what they're seeing is not that. It's typically biased, so you have to take the time to figure out who is publishing the article and what their agenda might be. Or even further, one state legislator said, who elected those institutions of higher education to do the research? Who elected them to tell us what to do? So these bigger questions about democracy, democratic decision making came up in some of these conversations. But a bright spot. So a colleague of mine, a collaborator I'm working with, Jonathan Pirtle, is at the Drexel School of Public Health. He published research last year, data collected in 2018, so post-Trump, which actually had some heartening news about how the public believes evidence should be used in policymaking. So he found in his nationally representative sample that 59% of respondents believed that evidence should be used in influencing policy decisions in Congress, and actually found no differences in sort of that belief by the partisanship of the individual survey respondent. Everyone also believed that evidence should have more of an influence, and that it doesn't have the same type of influence in policymaking that pharmaceutical companies and insurance companies have in health policy. So next I wanted to tell you a little bit about what we found about the public's perspectives on the politicization of science. In order to undertake this work with my colleagues, Rebecca Nagler here at the Hubbard School of Journalism and Mass Communication, and Erica Franklin Fowler at Wesleyan University, we first had to understand what politicization even means. So I think we say that word all the time and think we know what it means, but in fact the scientific and sort of theoretical literature offer very little guidance on what politicization of science means. So we identified three possible domains that politicization might convey. One is the strategic, sort of purposeful exaggeration of the uncertainty of science. So very similar to the cartoon that Sean just presented, that strategic battle between actors who have a goal they want to achieve, and they want to achieve that goal by saying the scientific basis for some premise, some fact, is not as solid as others might say it is. 2 + 2 = 6. Another definition of politicization is when scientific issues move from a sort of domain of science or medicine and jump into a political sphere. When politicians start talking about scientific issues, that's when we often hear news reporters say, this issue has become politicized, or the public bemoans the politicization of this issue because now policymakers are talking about, say, childhood vaccination, rather than only pediatricians. And the third definition is an enhanced, and again, a goal-driven emphasis on controversy and debate about a particular health or science issue. So we sought to understand sort of if those were the three domains of politicization, then where does the public fall, and how the public thinks about issues and scientific uncertainty and political discourse around these issues. And this is where I want to emphasize that point about heterogeneity. There's no one view about the sort of solidity of science in general. It depends on the issues. And so what, if this pointer is going to work? It's a very weak pointer, but what this figure shows is the percent of the public that believe the evidence base behind these 9 issues to be fairly certain in darker shades, and then getting lighter toward less certain evidence base behind these issues. And the gray at the top of the histogram is the percent of people that said they didn't know. And so what we can see is that the public has a sort of very solid, 80% or so robustly believe the science behind seatbelts saving lives. It's only 8%, but 80%, yay, believe the science behind seatbelts is sound. Similarly strong perception of scientific support, scientific certainty around mammograms. And then you see it goes on from there. I was really interested in this because I've done a lot of my research on soda tax. And in this study, we found the public very skeptical about the idea that a soda tax might be effective for public health. But you can see, again, this gradient in how much scientific certainty exists around these sort of core science and public health issues, with childhood vaccines being one that we often talk about, with a sort of 60% believe the scientific evidence of vaccines to be solid, lower for the HPV vaccine. And you can see climate change is the source of much discussion around these issues of politicization. About half the public believed that the science around climate change was very certain. So the other element of politicization is how whether these issues have moved into political discourse from more of a medical or public health or scientific realm. And you can see this is sort of not surprising at all, where the darker bars indicate people's belief that these issues are often a part of politics. We see the highest proportion of the public believing that for abortion and climate change, and then decreasing for the other issues I've shown here. So we think, again, sort of seatbelts being what we hope to be the paradigm of the sort of solid, politically neutral issue, as expected, sort of the fewest percentage of the public believes that issue to be in the political domain. So the bright spot, though, is I think I want to emphasize that the public support for scientific research is still strong, potentially even growing stronger, as these Pew data from earlier this year noted. But there is polarization in perspectives on scientific research funding, with significantly more Democrats believing that there should be more federal funding for scientific research than Republicans, and that partisan gap is growing. So just to conclude with the third sort of piece of research evidence I want to share today, I already mentioned sort of some concerning elements in the public opinion survey on the proportion of the public that believes there's uncertainty in the science of HPV vaccine, with about a third of the public noting, not necessarily that they perceive the science to be uncertain, but that they note discourse that represents that as uncertain, which is an important nuance. And then we looked at how much the public supported different policies that would increase uptake of HPV vaccine, and found that those individuals who perceived more uncertainty around the science base, the evidence base of HPV vaccine, were less likely to support those policies. That was a study that we published earlier this year. Bright spot here, and I think that's what we're all about today, is thinking about the emerging collaborative research that's cross-disciplinary, that's with folks in journalism, practitioners, and the members of the communities, affected communities, and the public alike. So just a few examples. So I want to give an acknowledgement to our newest colleague, a health communication colleague who's in the School of Journalism, Emily Braga, who's had some great work looking at experimental interventions on understanding how experts, and particularly public health sources of expertise, might intervene to correct misinformation on social media. Also wanted to flag Gary Schweitzer in the School of Public Health here. I'm not sure if he's here today, but has started to write about how bolstering trust in journalism is an analog and needs to come along with our efforts to bolster trust in medicine and public health. And finally, a nod to what you'll be hearing more from Brian and his organization at RTI on convening organizations from funders to academics to practitioners on how we can really better understand and implement interventions to build and maintain trust in science. So I'm also excited about the outlook for my own research in this space. I have ongoing research with colleagues from multiple disciplines, multiple perspectives, looking at the effectiveness of translating evidence into policy, particularly a new study on ACEs, and sort of trying to better understand how the science of ACEs might translate into policy circles. Ongoing analyses of media coverage of public health issues, particularly with a focus on the extent to which evidence is or is not part of media presentations. And long interests in understanding both the effects of politicized science on the public, as well as what might be the buffers to or ways to inoculate against the effects of, if there are negative effects of politicization on the public. So thank you very much.
afternoon. It's really a pleasure and honor to be here today. There are a couple of reasons for that, not the least of which, actually, is that this is a bit of a homecoming for me. I had the pleasure of spending about a decade here at the University of Minnesota, about a decade ago, and I can remember when this building was new. And so I appreciate the chance to come back and celebrate the tremendous work of the School of Public Health and other colleagues around here at the University. It's a special place, and I appreciate the chance to help celebrate it. I'm also happy to be here, particularly today, given the theme of our topic, the theme of our panel. And the reason for that is that often there's a bit of disconnect between the types of things that I might be up at 2 or 3 in the morning and worrying about in terms of the state of the world, and then the day-to-day actions that I might get up and engage in the next day. Worrying about the details of a grant or timesheets or committee meeting minutes. And today is a nice synergy, and I think a lot of us feel that same sense that we are dealing with in this topic something that is affecting the world that we're living in. And so I want to continue this, hopefully, on a trajectory towards hope. But I do think there are some aspects of what we might find in gatherings like this and in talking with other people who are worried about some of this. I think we might find more reason for optimism than sometimes portrayed. So I want to talk to us specifically about an angle to this larger discussion that I think is really part of the first 2 discussions and needs to be part of our discussion overall. And it's this notion that we live in a moment where there's been a great proliferation of misinformation. And you don't have to work very hard to see reference to that. In fact, we are even talking a lot about the fact that we have so much misinformation in contemporary journalism. Regularly, in the last couple of years, different news outlets have nominated misinformation or some other variation thereof as its word of the year. This is a concept that we are worried about and struggling with. And part of what I want to point out today is that, in a lot of ways, we've been here before, actually. That if you think about the history of mass media content, the history of societies where we've used these tools and been able to present information to each other, first of all, we've been lying to each other pretty much as, from the beginning of when we started talking to one another. But when you stop to think about actually some prominent examples that exist when it comes to electronic media content, even in the U.S. context, there are a number of prominent examples. If we turn back to the turn of the 19th into the 20th century and the run-up to the Spanish-American War, and there's a lot of concern about the nature of what was appearing on front pages of newspapers in terms of the depictions of actually what was going on in the Caribbean. Move ahead to a fall evening in 1938, in which parts of the country heard a radio broadcast that suggested that New Jersey was being invaded by aliens. And I won't offer any comment there on New Jersey and the likelihood and possibility of that. But it turned out to obviously be a radio drama. People had turned into the Mercury Theater players, Orson Welles, and their depiction of the drama and an earlier novel, War of the Worlds. And so we had examples, we've been here before. In more recent years, though, there have been some examples that I think get closer to part of the discussion that I want to have, which is thinking through and thinking why it is that people engage with and believe and spread some of this content. And so I had the opportunity earlier this year, actually, to travel to Western Australia. And the timing on that was quite remarkable in a lot of ways, because I've had some discussions with the Cancer Council of Australia about offering a keynote address for this concert, for this conference. And in the run-up to that, I learned about the story of Belle Gibson. And Belle Gibson is somebody that you may or may not have heard of before, but she's a fascinating figure in lots of ways. She label her as an advocate for a particular viewpoint on the role of diet with regards to cancer. She advocated for particular ways in which we might actually address cancer. In fact, made claims about having cured her own cancer through various dietary means. Turns out, unfortunately, that Belle Gibson never had cancer, and the whole situation was a fraud. And what's fascinating about it, though, is not for us that we can sit and point fingers at Belle Gibson, but she and still is quite a figure in Australia. She rose to prominence and had a number of people following, engaged with her story. And there's something about that I want us to focus on. I want us to focus on why is it that people grasped onto the story that she was telling. What is it that people were looking for? Why was she such a compelling figure? There's lots of, she's a a person who has a lot of eloquent things to say. She's dynamic and photogenic. There's that aspect of her being a media spokesperson. But there's also something in the story that she was telling and the hope that she was offering that I think allows us to respectfully think about the community that we live in, the society, the population that is actually engaged with the misinformation we might be so worried about. So I actually think it's fair for us to take a look at ourselves here and to think about certain facts, certain understandings we might have about humanity that I think leave the door open for the situation we have currently. First is that we are social beings. You spend some time engaged over lunch talking to other people. You spend some time talking with family or friends today, and that's really core to who you are. And that matters. And so we are going to have the possibility for social media platforms and for other ways of capitalizing on that need for social connection. It's going to be with us because it's part of who we are. Second, I think we all, in this particular instance, need and want for some optimism or hope. But generally speaking, I think all of us need that in order to continue on. Think about the moments that you have in which you don't have much of that, and it's a dark place to be. And so if we are faced a situation where we don't have either of those things, that's where I think we need to most worry about the availability of and proliferation of misinformation. It's not the simple existence. It's not the sheer amount of misinformation we might worry about. It's the type and the instances where we might see this leading people to different decisions than they otherwise ought to be making, but we have to look at this backstory first. Now, we've had a chance to enter into this arena. There's now been a great flowering of academic research. Sarah and Sean have mentioned some of this. I've had a chance to participate in some of this as well. Here we've got a new book out called Misinformation in Mass Audiences. Actually, one of the leads of the chapter leaders, Dr. Benson Bowman, who's my colleague, is here today. And this is an opportunity to bring together what I think it needs to be a very interdisciplinary conversation, to think about all the different aspects of life, that this isn't really just a public health issue at all. It's not just a medical issue. It's one that has to do with the nature of our societies, and that's something that I think a lot of the authors were able to look at there. We also have had a chance to look at this, for example, with colleagues at the National Cancer Institute. And there are a couple of themes that we raised there based on a workshop we had last summer. And so much of it has to do with really getting an understanding of the landscape, realizing that not all of the quote-unquote misinformation that's out there is equally important or consequential, but also realizing that there are really important aspects of our humanity that are going to need to be what we address if we're going to look for solutions. So I want to offer just a few words on that. Before I get there, though, I have a deep sense of hope and optimism. I also have a deep sense of realism about this situation, this issue being a part of our collective discussion. And I have reasons for that I had a chance to summarize in a couple of other places, but the short story is really fourfold. First is that actually, I think the best psychological evidence suggests that we are, for the most part, geared to accept information and then to make sense of it as being true or false. That's slightly different than being able to screen out falsehoods as sometimes been suggested. We can talk much more in depth about that maybe in the Q&A or afterwards, but that's something that I want us to look at as I think being the theme that you would conclude if you look at evidence on this. I know in saying that, in a talk like this, I end up undermining my own talk. It suggests that you're going to believe everything that somebody says initially. I want to promise you that I'm not lying to you, and hopefully this all holds up upon further consideration later today when you go read the citations. I also want to suggest, though, that as to the social being, so to connect this back to that earlier thought, there are reasons why we talk to each other that have to do more about our connections and relationships with each other than they do with the truth or falsehood of the facts that we are portraying. Doesn't mean that veracity is not useful, it often is. But it's probably more useful that in some instances you are showing a bond or social connection with somebody. Think about conversations you might have in an elevator about what a cold or beautiful, depending on your viewpoint, today is. You both have just been outside. You're not providing any new information. You're doing something in acknowledging that person as part of your community, though, that really matters. And I think we're seeing a lot of that happen online and elsewhere. People are really grasping that and hoping to find the ability to cling to some identity, tribal or otherwise, and that connection with other people might allow them to traffic in problematic information. Third, we live in a democracy.
My experiences in Tanzania. That 350 is unbelievable.
That, or I'm going to be drowned out here by powers that be.
Can you try that?
I don't know if we want to discuss it. Okay. It's a little creepy in a conversation. We good? There's just a brief interlude, I think, but that's okay. just some distractions. Back to the really important point, though. So at the end of the day, in a democracy like the one that we're still lucky enough to be holding on to in some ways, we have a regulatory structure with regard to our information environment that's going to continue to allow misinformation to occur. And I wouldn't want it any other way. Because we have a situation where
we're finding in Tanzania that some people can get.
Well, how is global dimension of our discussion?
Okay, but what's happening? This question.
Okay, thank you. So, short story here though is if you look at agencies like the FTC or the FCC or the FDA, and a lot of what they do is post hoc regulation. They realize that there are problems. They realize there's problematic information out there. They seek to address and remedy it. That's a good situation. The alternative to that is a situation that's probably not tenable anyway, but really being able to sanitize and to censor an environment. And I think there's really problems with that. And so that's something we can talk further about as well. Last is we know that it is possible to correct people's misperceptions. But doing that work is really difficult. You have to fight fire with fire with regard to the amount of exposure. If you've got a problematic Super Bowl ad and then you put a corrective, issue a corrective statement on your website somewhere and hope somebody's going to see it, it's probably not going to get the job done. We know that based on a lot of experimental empirical evidence that we need to work hard in order to overturn correction. So, and just a few more remarks here then. As we think about the ground we've, how and reasons why we might be vulnerable to this, people talk to each other for a variety of reasons. They're trying to make certainty out of an uncertain environment. And if we can view information as potentially currency for relationships, I think that puts us in a better spot to understand what's happening in social media platforms or in problematic text message exchanges or in problematic interpersonal exchanges than we might otherwise be thinking about it. So just a few words here then on what can we do. What can we do next? I've had the great opportunity and pleasure to be able to work on a number of initiatives at RTI International. I'm also with my colleagues at Duke in the School of Medicine. And this is a journey that's taken us actually around the world. So we can talk a little bit further about this. But I've had the opportunity to go out and speak with a number of different groups. Groups, for example, like the Science Museum Association in Europe, put by the acronym XSITE, in which we've talked about addressing misinformation. We've had an opportunity to organize efforts and forums in Research Triangle Park, and I can talk a little bit more about that as well. Looking ahead, though, part of what we're doing is really going to be a pivot away from worrying about and bemoaning the existence of misinformation towards, instead, building situations of trust and community. So there's wonderful synergy there with things we've already heard. But part of the reason why what we've heard so much matters now is that this is actually going to be one of our paths forward for addressing misinformation and its proliferation. So we're working on a few different initiatives. I'll just briefly touch on those. One has to do with a much underappreciated institution that I think we ought to be better engaging with the community college infrastructure in this country. I think that offers maybe one of our best hopes for reaching institutions that bridge across political divides, that are respected in many communities, even in those that vote red versus blue. And I think that's a place where we need to engage. So we're going to do that. We also are going to turn the attention towards professionals like those of us in this room and realize that part of the problem is that we are in a situation of looking down our noses at and shaming those folks who are engaged in trafficking in misinformation. I think we need to do a better job of actually empathy training for our physicians, for our public health professionals, for our medical professionals. We're engaged in that and actually have some support for that to start in 2020. And so let me just briefly talk about those here quickly for those who might be interested. We're working with a program at Duke University now to offer training for rising medical professionals on what to do when your patients essentially present with or bring into the examination room misinformation. I view that as a critical moment. There's not a lot of time to have that conversation, but so often it is either dismissed or dealt with in a way that I don't know is particularly helpful. So we've gotten great receptivity for this. We're going to be piloting this both at Duke and also we're in conversations with Grievance at UC San Diego and at Tufts University and maybe other places that might be interested. We've got some support to pilot this in 2020 from the ABM Foundation and Craig Newmark Philanthropies. But at the end of the day, just to put sort of to wrap that up together, it's really about building relationship, really not taking for granted that trust matters, that's going to be our way forward on this, and getting to the hard work of ensuring that that happens. And that's been the problem for us, really, for much more than just the last couple of years. So I'll thank you with that, and I think we'll turn to a Q&A. Thank you very much.
questions. One of them is, how can we, stakeholders in a university community, use our scientific knowledge and skills to counteract this anti-science movement? What are some strategies, for example, for making scientific knowledge and facts, as distinct from opinion, more accessible and acceptable?
Sure, I'm happy to start us off. So actually, I've been reflecting on that question. I want to pick up right where I think Brian left off, which is on the role of people in academic institutions to get out of them and into communities. I think community engagement and relationship building is incredibly important in all of the work that we do. So whether that's building relationships with the journalists who can then turn to us first, as opposed to all the many other sides of issues, or relationships, deep and authentic relationships with community to better understand what it is that what research means, what science means, help build that research literacy through not just us telling them sort of a deficit model that there's people that don't have an understanding that we need to fill, but not only co-creating knowledge through partnerships, but also kind of deep understanding of what the origin of any potential misinformation might be.
That's great. Just a quick comment on this. This is great that we're having this discussion. There's just a lot I think that we can do. Actually, though, something that comes to mind, and I don't often have an opportunity to talk about that publicly, but Lisa mentioned that I also have the pleasure of hosting a public radio show. And it's the show called The Measure of Everyday Life, on public radio back in North Carolina, but available podcasts worldwide. You can find it. But that notion, what Sarah just articulated, actually is the animating reason for the show. Because what we do on the show is start from the premise that a lot of people would be interested in the amazing work that social scientists and researchers do, but it needs to be framed in a way that we're all in this together, and that it's not a matter of pedantically offering this insight one way or the other. So we really strive to have this be an open conversation to point out that researchers are people too, that there are really interesting stories and reasons why they have for doing this work. One of the best ways to engender a sense of trust is to articulate and to realize that there are reasons why we have shared values and shared interests in the future. So opening up and talking about some of the motivations for research, I don't think has to undermine the credibility of rigorously done research. In fact, it can actually raise that value because you can say, look, I don't want the world to end either, and so we ought to do this climate change research. I want there to be a world where we have equity when it comes to public health. And so I think that's where I think we sometimes remove ourselves, and I believe that we absolutely can believe in objectivity and in facts. We also can acknowledge the humanity that the researchers have, and so it's something we've been trying to do with the show.
Yeah, I totally support that. There's a lot of evidence that shows that the emotional charges you add to what you say really imparts a lot of the credibility that people take away from the conversation. The other thing that I was going to say is that I think that Brian does really well on the show from a couple of episodes that I listened to is that you break things down. Instead of presenting a conclusion, open it up and share the process, because then people can come to the conclusion on their own and they have a lot more ownership in the knowledge than they do if you just kind of push a conclusion at them.
There is anti-science. There's also just unscientific opinion. We've discussed some people's anti-science beliefs must be very deeply held, while others might be more malleable or loosely informed. What do we know about how to correct scientific misinformation? That is, can beliefs be changed that are anti-science?
So there's a couple to add. I'm not sure if I'll remember that. Too. So we know that the literature and a lot of what's happening here at the university as well on correction suggests that it's possible, it needs to happen relatively immediately, ideally, at a level of exposure and clarity that sometimes goes beyond what we typically do. And so pointing out that being able to articulate, one of the things we found with the corrective literature is that it's much easier to actually directly, explicitly address an explicit, obvious error than it is to address those other lies, which are lies of omission. Instances where there are dog whistles, instances where there are things that are not quite said, but are implied. Those actually turn out to be hard, because you don't have, and you think about it just from a cognitive standpoint, there's not a specific node or spot to actually address and correct, that sometimes that can be a little bit more difficult. So that's one of the challenges that we're facing, there. But one of the other things, I really appreciate that, Lisa, and your question. We have to realize that there are absolutely the kind of nefarious and really problematic actors that Sean's pointing out. It's a threat to all of us. But it's also not everybody that's out there clicking accidentally or purposely on Facebook and spreading some of this. So it's all the above. So, Sarah calls for nuance later, and let us recognize that there is, political scientists will often talk about that, the remarkable fluidity, the remarkable, the extent to which you look at, the extent, and not to get overly political here, but I draw inspiration from a place where some people point to and criticize. In the United States, we now have widespread acceptance of gay marriage, and that happened over a relatively short period of time. That suggested a remarkable lack of actual underpinning in terms of some of the security. It suggests a lot more fluidity. Phil Converse and others would say that a lot of American political opinion is not as deeply held as you might think. But there also are these other forces, so it is sort of an all of the above, I think. Correction. Sorry.
And part of it is also, again, social connection. A lot of reasons using the marriage amendment, organizing around that happened. That was based on some science out of Berkeley that showed that a personal one-on-one connection with people from someone that you know is far more influential than what you might hear from someone else through the media. And so the strategy there was to build millions of one-on-one conversations, and that, in fact, turned out to be enormously powerful.
Sure, I was just going to say it's about understanding, again, the nuance and the origins of any beliefs, whether it is the sort of, if it's in like the rock hard, I believe this and I'm never going to change my mind, versus a source of mistrust or anxiety that can be overcome through deliberation and through more of a conversation. And also, I think, speaking to what Sean just said about who's the right messenger to make inroads with a community that might have beliefs that are not aligned with what sort of public health thinks is true. So thinking about that combination of what is the origin of the belief and then who is the right type of messenger, a credible messenger within communities to help do the work of changing minds in this case.
Actually, build on that, because it's something that is true for the room that we're in right now. I think we can do really important, powerful work that also acknowledges that in a lot of those conversations, the right people aren't us. We're actually terrible in terms of that. And I think we can work in collaboration and partnership and still be involved in that work, but then it doesn't necessarily need, I think that's a really important thing to raise.
Okay, I'll bounce off that one. So there's another model that we can draw from in this, and that's couples therapy. A lot of times when there's entrenched anti-science positions, taking that kind of emotion-based, mirroring, one-on-one approach that was developed through couples therapy has been shown to be actually really effective in breaking that down again. It's the messenger, but it's also the quality of the message. It's how it makes you feel and why you're motivated to talk to your neighbor that you care about this issue.
I want to get to the international issue, but it strikes me particularly after listening to Sean's presentation, you're pretty hard on journalists, particularly TV journalists. And so, and yet every journalist who's a professional journalist wants to present facts and to show the evidence, and not necessarily the truth, only because they want people to come to the truth based on the facts as they know it. And so their job is to not knowingly present a falsehood. That is the ethical, professional ethical practice of journalism. So how can we raise trust in journalism? I mean, I have some ideas about this, obviously, in the journalism school, but I'm curious, from people outside the works, what do we need to be doing to kind of help journalists carry messages better from your own perspective?
Well, one thing I think is emphasizing evidence-based journalism, which of course is it's a lot harder in some cases, especially in the environment of slashed budgets and competition with all kinds of free or special interest underwritten journalism on the internet. But the challenge, part of the challenge and part of the great opportunity that we have is the increasing advance of science into more and more into areas that were once just the province of opinion and faith and ideas. For instance, the advances in kind of the consilience between computer science and neuroscience and what that is showing, for instance, about the effects of free will and the implications of that for how we approach criminal justice issues. That's a giant social issue that is exceedingly complex, but that actually, if we can get ahead of it in our storytelling about it, we could perhaps yield some really positive public policy outcomes.
It's great. I just want to offer a comment that your question sparked. A few weeks ago, I was part of a weekend retreat held, organized by the law school at the University of North Carolina, Chapel Hill, but it was really thinking about democracy and society. And it was the Saturday session, we spent the day focused on worrying about news deserts and worrying about the demise of local journalism as a real threat to all of us. And it struck me in that moment, so much of that discussion tends to be about bottom line and budgets. And when you think about it, there's a larger story when it comes to science journalism, health journalism, that's one of the first beats to go, and this isn't, but actually, in that discussion, it struck me that there might be synergy there, in that part of what you could do to get people to care is also operating on a very local level, telling stories about how science matters in this neighborhood, or for something we're trying to do in this state, and to tie it, giving people reason to care, but also drawing in. I think we tend to think about that as a lost cause, but I actually think I think there's a lot that could be done at a local level that's being overlooked right now. We're sort of this, you can probably speak to that most directly. I don't know that the story's done in terms of locally based journalism. I think there's still an audience for it very much. We need that. We're going to have to build back up from that. And I feel like this actually could somehow be part of that story. What do you think?
I think so. I mean, I think that people have faith in medicine when they see what happens in science through powerful stories of human condition. Our gophers, fighting cancer, et cetera. We've had lots of stories like that. And your point on the lack of people also trust news that's more locally connected to them than national news. It's like all politics is local too. There's definitely that, so that makes sense to me.
Well, I was actually going to ask you more about how you see your role in directing a journalism school in this really, heightened concern about trust in journalism. What are you doing, and how are you drawing students and training students in careers in an era that looks very different from the used to?
What looks so different is that there's so much growth in the areas of strategy, in media strategy, social media strategy, other media strategy. And so in the journalism school, we are both teaching traditional multimedia journalism as well as the strategy area. And the challenge of the school, and what I talk about most, is to talk about the ethics of professionalism. And journalism gained prestige as science gained prestige as the ethics of the profession emerged and became understood. And it's that decline in the ethics of the profession, or the perception of the profession, that's hurt it in the same way the image of the scientist has also been similarly, I think, maligned with corruption. It's the fake news, fake science, right? They're and so the challenge, I think, for all of us is to restore trust and faith in institutions. And so I think that's the professional societies and teaching professional ethics and talking it and doing that kind of work on the work level.
Do you think that there's any, I'd be interested in your opinion on the role of open journalism and more transparency in scientific information? Good thing, bad thing. It would certainly help journalists, but it would also probably help misinformation efforts or confuse the issue with even more noise. What are your thoughts on that?
The open science thing is such a tough one because it's like you see the innards of the work, and it can be so confusing. It adds a lot of ambiguity, uncertainty. More gets published, and there's sometimes in some areas of the field more open access, but it's less quality in terms of what's reviewed and published. I don't know. I've been an editor, Brian. You've been thinking about this for a while.
Well, so there's an aspect of this that I also love to bring up in conversations like this. I think that's related, which is part of the issue. There are blatantly ridiculous things you can find online. All of us could have come up with examples, but we all would have gasped and laughed at them. But I actually think a lot of what I worry about are things that are sort of at the margins of the publishing industry we put together. There's a lot of journal articles that look like journal articles that technically are journal articles that are garbage. That are so there's problematic information. There's sort of this continuum. So I think fighting a good fight, continuing to do rigorous work. We haven't ever done it perfectly. There's no need for it. And so you think about in the anti-vaccination, vaccine hesitancy world stems from a retracted, peer-reviewed article, partly. you know? And so that's part of it, is I think a matter of not being so holier than thou about, and realizing that we need to actually, you know, tighten up all of that. So I think that's, you know, that's part of it, you know, too, yeah. But
I promised I'd get to the global piece, and I do want to leave a few questions time for the audience. So, at least Brian and Sean for sure, you have a lot of global experience. What can we learn from others outside the United States about counteracting this anti-science movement or position or movement?
just a couple things.
Outside the United States about counteracting this anti-science movement.
Am I worried about? One thing that's been fascinating to me, though, is also thinking about the nuance and differences in different circumstances. And partly what comes to mind when you ask that question, is I think about, you know, certain societies and circumstances where what you really need to do to get your finger on the pulse of how things are proliferating is to look at, you know, WhatsApp exchanges. Or in other instances, you need to look at, and so we can't go into the one-size-fits-all sense of like the media institutions or that matter in different places. That's going to be something we're going to have to, I think, be adept. And also just the approach and the struggles that people are facing. At that Excite meeting, people were really rapt attention, fascinated at this. There was a team from a science museum in Malta who came, and their big challenge was, and their big effort, and it was hugely controversial, was around presenting scientific information about the process of abortion. And introducing that as part of a science exhibit in a museum, and in a Catholic country, in a situation where this was really problematic. Of course, you can imagine the political reasons why that might matter in other places as well. But there's a difference to the point of emphasis where they're starting from that I think we see quite a bit of variation in terms of the exact issues that matter most. There are probably reasons why we have some of the situations that we do for the issues and controversies that arise in the U.S. that might be different than other places. So part of it is keeping our ears open to some of the diversity that might exist in other places too.
I think it comes down to really looking at the local issue again. Like take the anti-vaccine movement. In Texas, it's a libertarian argument about parents should be in charge of what goes in children's bodies instead of the government. In Oregon, it's suspicion against big pharma and suppression of studies that they suspect show that vaccines include lead or include mercury or other unhealthy substances. In several Muslim-majority countries, it's about cleanliness and injecting something into your children's bodies unclean. Or in Indonesia, a fatwa was issued last year because the MR vaccine is manufactured using an enzyme and gelatin that are derived from pork. So it varies depending on the cultural context. And I think that sensitivity to that and understanding that is probably the key, which again breaks it down granularly to those very local conversations.
I just want to add just one other quick point, though, in terms of a notion of potential commonality, an issue that a lot of people are facing in a lot of places. We worry about, for example, the spread of Western diets and what that's done in terms of public health. Well, similarly, you think about this from a sociological standpoint, and the transformation that a lot of societies are going through, in which, in a lot of places, they have the problem of everybody being connected through their phone up to this larger national, international culture, and not necessarily having the place-based spaces of forums and connections. That's happening in lots of places, and that actually is at the root of a lot of what we face right now too. I think we can do a lot by getting to know neighbors, by putting people in places where there's known possibilities for verifying and trusting other sources of information. But building those things are expensive, and it runs a little bit counter to sort of the global and technology trends that we're seeing in the way that societies are organized too. So I think that's one overarching thing.
I'd like to see if we have time for one or two questions. Yes.
We actually need to wrap things.
Okay.
Thank you, Brian.
We'll be here if anyone would like that.
Brian, you mentioned a couple of examples, historical examples, where misinformation inflamed a specific circumstance. I wonder if there are periods of history or eras of history that are particularly good examples of general misinformation over time, or the public being more wooed towards misinformation. If so, what was the slide into that due to, and how did those societies recover or pull themselves out?
It's a fascinating question, and we probably don't have time to get into all of it, but one thing that comes up is a paper that a graduate student of mine worked on a number of years ago, looking at Shanghai, in the 1930s in China, looking at the impact of misleading and scapegoating medical advertisements that really were pretty misogynistic. It pointed to larger points of flux and instability politically that led to sort of vulnerability. And I found that different than where we are now, right? So that's something we might look about in instances where people have need for political or social reasons to gather together, connect with other people, or fight other folks. That might be a place where health and science is dragged into that politically sometimes. One quick off the top of my head, Jess. We can talk more.
Thank you all. Thank you for